Thank you, Chairwoman Ward, Chairwoman Collette, members of the Senate Aging and Youth Committee, good morning, and thank you for the opportunity to testify. My name is Zach Shamberg, and I'm the President and CEO of the Pennsylvania Healthcare Association, better known to most as PHCA. As you know, we're a statewide advocacy organization, and we represent nursing homes, personal care homes, and assisted living communities. We represent the providers, we represent the frontline workers, and most importantly, we represent the vulnerable residents they serve, all of whom have remained at the epicenter of the COVID-19 pandemic. In fact, it was a little more than 1 year ago, in May 2020, when we testified before this committee and pleaded for your support. Support for testing, for PPE, for staffing, and for emergency funding. It was a moment in time when long-term care providers, their workers, and their residents desperately needed resources. Yet their cries for help were continually being ignored, but not from the members of this committee. This committee did something that was almost unheard of at that time. You listened and you acted. And your actions made a real, tangible difference for those at the heart of a crisis. Today will be my fourth opportunity to testify before this committee since the COVID-19 pandemic began. And I do want to thank our chairwomen and each member of this committee for truly giving a voice to the long-term care sector and the providers and the healthcare heroes who we represent. Now, I am here today because I trust this committee will act, will advocate, will step up in the fight to protect our seniors in long-term care. And I can report to you today that that fight is far from over. But I can also tell you that real progress has been made, and COVID-19 is being contained in our facilities. Case counts have plummeted amongst our residents since the January surge, with a 92% drop in the average number of weekly cases and a 93% drop in the average number of deaths. Among staff, those averages have dropped nearly 80%. The data is very, very clear. The vaccines have been effective, and with the right resources, mitigation efforts have proven to be successful. But every earthquake has an aftershock, and every major storm leaves behind irreparable damage. As the dust begins to settle from the COVID-19 pandemic, long-term care providers and their workers are left to look at what remains. A depleted industry in need of critical emergency funding, an exploding workforce crisis, a punitive regulatory environment, and a legal climate that has already forced many operators to relocate far, far away from Pennsylvania. Believe it or not, 2021 could be an even tougher year for long-term care, but for a very different set of reasons. PHCA members, some of whom lead family-owned facilities that have operated for more than 50 years, are now finding it more and more difficult to maintain their operations. These providers, your constituents, have been employers and economic drivers for their communities for decades. But as they attempt to emerge from the pandemic, the residual effects of the past 15 months have threatened the very care they provide every day. The pandemic exacerbated, it amplified, and it accelerated our industry's underlying issues, and it pushed the providers who we represent to the brink. So today, we come to you with solutions and a call once again for your support of an industry that is essential to the third oldest state in terms of our population in the entire country. First, Pennsylvania's latest federal stimulus package, or the American Rescue Plan, must prioritize long-term care. Which industry needs to be rescued more than long-term care in this country? Skyrocketing costs from PPE, from testing, infection control, heroes pay, and hazard pay for staff, all costs that continue today have made this model simply unsustainable. Compounded with stagnant Medicaid rates, it's no wonder our providers are telling us they can't afford to keep their doors open much longer. So what happens to hundreds of workers who are currently employed at any given facility? What happens to the hundreds of vulnerable seniors currently receiving care? If a nursing home closes its doors today, where do they go? We don't know the answer yet, and Pennsylvania cannot afford to find out. The American Rescue Plan is not about success, it's about survival. And when you are considering these latest stimulus funds with your colleagues, with members of leadership, I beg you on behalf of long-term care to prioritize those at the epicenter of this pandemic, just as you did with the CARES Act dollars in June 2020. You enabled us to truly push through the storm. Now help this industry rebuild. Second, long-term care has not been immune from the nationwide workforce shortage, but we fear, due to the pandemic and due to the exhaustion, the fatigue, the burnout that we are seeing in so many of our healthcare heroes, that a mass exodus may be coming. But the issue runs deeper than that. A year before the pandemic in 2019, our then Auditor General released a report that was called "Who Will Care for Mom and Dad?" Its focus was on the Commonwealth's rapidly growing demographic, our aging demographic, a growth rate that has dwarfed the number of workers available. Together, and with the members of this committee, I believe we can work to reconstruct a new long-term care workforce pipeline. We can fortify our existing workforce, and we can ensure providers can invest in the men and the women on the front lines with better wages, benefits, and incentives. But that's going to require the appropriate investment from state government first. And finally, we must address our regulatory climate. Throughout the pandemic, we have been clear. Regulatory waivers have been vital to this industry, but not every regulation was waived. In fact, long-term care providers and workers were sometimes receiving new guidance or new mandates once a day, twice a day, often late on Friday evenings, that could be construed as duplicative, contradictory, or just plain confusing. We can work together to address those regulations. We must ensure that paperwork does not take precedence over our patients moving forward. I'll end my testimony today by saying this. You've invited us to address the current status of long-term care and the ongoing needs of providers, of workers, and of residents throughout the Commonwealth. As I noted earlier, the dust has settled. The past 15 months shook this industry to its core. And the concerns that I've outlined today, and whether or not they are addressed, will determine if long-term care providers can continue caring for our most vulnerable population. And if they can provide that essential care, who will? Thank you very much.